This meeting is now being recorded.
Great. So thanks so much for joining us. I've gone ahead and put everyone on mute just to minimize background noise. So throughout the webinar, as we normally do, if you would like to ask a question, and we certainly hope that you will, you have two choices. You can either use the public chat box, which is in the bottom left-hand corner of the screen. You can see I left a note earlier that said if you were having trouble with anything to let me know. So you can type questions there, and if you do that, everyone can see those. And feel free to do that at any point during the presentation. You don't need to wait until it's over. And then the other option is you can use the Q&A chat bubbles, which are in the top sort of upper right-hand middle part of the screen. There's an orange and gray chat bubble. So if you click on those, you can submit a question that way as well, and those will remain private. We're, of course, among friends, so no worries about asking anything that you'd like, but you do have those two choices. Other than that, you should be seeing like a tree or another nature scene at the moment. As soon as I pull up the slides, you should see those instead. You can also click on the arrow next to CLPHA host to send me a private message in case you're having any technical difficulties. You can also feel free to send me an email. I'll keep an eye on that during the webinar as well. Otherwise, we're so excited to have today's presentation. We are going to have Marcia Baslow, who's with the Department of Health and Human Services in the Administration for Children and Families, who's been a longtime champion of this work and a great partner for us. And then also Rachel Langford, who's from Home Forward, which is Portland's housing authority. They're also really leading some great efforts and initiatives in Portland and still thinking through and learning what the next steps of their work might be. So before I hand it off to Cassie to give any other notes of introduction, we had talked about doing a poll. So I'm going to go ahead and pull that up. And if folks can just answer to what's on the screen, then we'll take it from there.
Great, and this is Cassie from Chicago Housing Authority, focused on education, and I'll be helping Abra kind of facilitate on the webinar as well. So we'll have two presentations today and a short, brief time after each presentation for some questions or feedback. As Abra mentioned, you can either do the Q&A or the public chat, but a survey would help us out to understand a little more about everyone's experience with formal partnerships around early learning.
So Marcia, Rachel, and Cassie, I don't know if you participated in the survey.
I just did. So.
I did.
Okay, awesome. So I think we have all of that. How do you? Sorry, technical glitch on my end. I'm having trouble seeing the results of the survey. Okay, well, while I'm working through what may be going on with my computer, I'm going to go ahead and pull up our first presentation slides. And Cassie, I don't know if you had any other announcements for the group as well while we have them.
No, just, I guess the last thing is if you haven't gotten to use or spend some time using the resource Housing Is, I would definitely encourage you to check it out. I was just on there myself this week and definitely think that there's some great opportunities to share resources there. I posted a couple. I know Abra's been posting some, but just to continue to think of that and seek that out as a resource would be very, very awesome if we all had participation in it. So.
Thank you so much. Yes, I obviously couldn't agree more. So again, I'm still not totally sure why I'm not seeing the results of the poll. Marcia, up to you. Would you like us to...
Well, you know what? I'll start. Why don't I start and just say thanks for joining, and thanks, Abra, for having me.
Okay.
I think what I'm going to do is I'm going to really try and give some big picture pieces about how you work with local HHS programs, and then Rachel is going to give you the really nitty-gritty about some fabulous things that she's done. And then I know we have some people on the call who can actually jump in and share some of their work, and I want to encourage you all to ask questions. Some of you may have been at the summit, and you may have heard some of this information. I don't know about you, but in my goal in trying to learn new things and thinking about other things, it takes me a few times to hear the same thing. So I'm going to quickly go through some information on early childhood and try and meet the needs of those who are new to early childhood as well as those who are already steeped in the work that you're doing. So the early years matter. We have a growing body of research on early brain development, and it tells us really that the early years matter much, much more than we used to think they do. In fact, the first 3 years of life is the most rapid, critical, and vulnerable period of development in the entire human lifespan. It's during this time the foundation of our brain architecture is formed through our experiences. You may have heard someone say that it's serve and return. It's actually the fact that positive experiences during this time build the foundation for later health. And it's the talking and it's the planning. Our brains continue to develop over time with increasingly complex skills building on the more foundational ones. You can think about the brain development like building a house. When we lay a weak foundation, everything that we build on top of it is going to be shaky. So it's really important that we have a strong foundation. To give you a little bit of an idea about thinking about how you might actually work with people in your communities, think about how kids grow. I think I went to the next slide. I may have missed a slide. But we think about infancy, toddler, preschool. We want our children to be socially competent and academically competent. And I think the key also is that we want parents who are proud of their children. So very quickly, I'm going to mention social emotional development. It's when children learn to identify feelings, establish relationships, getting to know who they are. And, are you in your program helping families to support social emotional development? Are you working with your libraries? I think that Rachel's going to talk a minute about some of the work that they've done. So that's one piece. Physical development, gross motor development. We know that little kids they run, they jump, they balance. But we also want to think about the fine motor development. Using muscles to draw, zip, cut with scissors, snap, tie. Can you help families to have them hold a pencil, write letters, draw a picture? There's really wonderful opportunities if you have a large space to be able to work with families to be able to do that. And then we have the cognitive development. It's really the process of learning to think and reason. And a child cannot use logic to correct a misconception yet. They can be fooled at a very young age. They're not yet ready to multitask. That's something that needs to be learned, the unidimensional thought. And a child does not realize that some processes can be undone. They don't totally get the irreversibility. So it's really the development of actively exploring their world, trying out new ideas, and observing what happens. And so we have a slide here on that early childhood has the highest return on investment. If you really want to plan some programs, that this is really where you're going to have the biggest bang for the buck. Jim Heckman started out looking for the return on investment in workforce development programs, and he's a Nobel laureate who's an economist in Chicago. And he didn't find the results he was looking for, so he looked earlier. He went to high school, he went to middle school, he went to elementary school, and he actually finally got to infants, and he found that the rate of return was so high that there wasn't a banking analogy that would do it justice. So why? Why is it important? Well, before the age of 5, it takes less time, intensity, and repetition to organize and develop the neural systems. We know that what happens early affects all of the child's development. The first 1,000 days is that birth to 3 years. Nurturing relationships are extremely important. And we know that toxic stress has a negative impact on a child's development, and why early interventions are so important. It's why we talk about developmentally stimulating and supportive environments, healthy meals, building resilience and strengths in children, protecting and supporting their health, having a sense of normalcy, stability, and so on. So as I said, I'm going to quickly go through there. Neurons that remain inactive or are rarely stimulated are eliminated. So you've got the 3-year-old brain, one that is normal, one with extreme neglect. And the good news is that Housing Authority providers can change the developmental and life trajectory of young children today so they don't become homeless adults of tomorrow. That's where you come in. A lot of really young children come through your doors during this critical time period. And although it may only be for a short period of time, your opportunity to make an impact is just enormous. 2 or 3 months or even a year doesn't seem like a long time to an adult, but for an infant, it is an eternity. And it's the first 3 to 5 years. Every single day counts. And so that's, making the most of it. So I'm going to talk briefly about ensuring that we think about long-term homelessness prevention and adopting a housing and babies first approach, providing developmentally supportive environments, and connecting children to high-quality early care and education programs and services. So the programs that I'm going to talk mostly about are the big picture programs that I mentioned, mostly federal: Headstart and Early Headstart, childcare, public pre-K, early intervention, home visiting programs, after-school programs. Hopefully you also got in the email that invited you a little worksheet. I thought that it would be helpful for you to see an early care and education infrastructure in my community, and I gave you a resource list with some links so that you could begin to think about where to look for all of these links, and then maybe what the program is actually called in your community, and to set up a contact list with name, address, email, and phone number. So the Head Start program is everywhere. It's literally in every place there's a housing authority, there's at least one Head Start program, either Head Start, Early Head Start, or Early Head Start childcare partnerships, and there's about 2,000 right now in the country. And the new Head Start performance standards are really big on the 2 big pieces, but first and the third are the most important here. It's that they have to develop a community needs assessment at least once every 5 years. You have the opportunity to be part of that needs assessment. You have the opportunity to actually develop an MOU with programs so that you can ensure that you are part of that needs assessment. They do now have the opportunity to reserve up to 3% of slots for homeless and foster children. And then they really must establish collaborative relationships and partnerships. Again, you want relationships with them. They really want relationships with you as well. The Child Care and Development Fund is the largest source of federal funds to help pay for child care. You probably know it as subsidy. It serves 1.4 million children under age 13 right now, and it's about $5.7 billion. It's in every state. And I wanted to mention the fact that with the CCDBG Act that was passed in December of 2014, there were lots of changes to the law. So the 4 areas that were changed, and I'm not going to go into detail and bore you on them, but I think it's really important for you to know that they really did impact 4 areas: to protect the health and safety of children in child care. And you're probably thinking, well, I thought we always did that. And that was not the case. But now it's around health and safety, to help parents make informed consumer choices and access information to support child development, and to provide equal access to stable, high-quality child care for low-income children, enhance the quality of child care in the early childhood workforce. The CCDBG Act initially was truly just a work support program, and with the new law that went into effect, reauthorization in 2014, it became work support and child development. And that really was a game changer. for the community. Here's a slide that shows you a little bit about the number of children and how they break out. If you're working with infants and toddlers and school age, you've got about half of them, and then of course you've got the school age children as well. One of the key areas that was changed in the new law is that they established a 12-month eligibility period. So you may or may not remember that families might go to get child care subsidy while they were looking for a job, or they started a new job and they would get child care subsidy for 3 months, and then they'd have to take a day off to actually go back and get their paperwork again. It's no longer, the much longer eligibility periods really promote continuity of care. They extend the time period that eligible children and families have access to child care assistance. We know that low-income families can experience rapid and, oh my goodness, multiple changes within a very short period of time. And unemployment and job loss are amazingly disruptive to families. So the retention of eligibility during a temporary period of employment or extended leave due to illness, for example, can alleviate some of the stress on families. And so this 12-month eligibility period was a huge game changer. We know that stable child care is critical to strengthening parents' ability. I next want to mention that there's state and local pre-K programs. The state-funded pre-K programs, I don't know how many of you are familiar with the NEAR report, which is the state of preschool, but I've given you the link in the PowerPoint so that you can look it up in your state. It really talks about how your state runs your pre-K, what kind of opportunities there are, what kind of requirements there are, and there's a lot. I mean, nationwide state-funded preschool program enrollment reached an all-time high, serving nearly 1.5 million children, 32% of 4-year-olds and 5% of 3-year-olds nationwide. The state funding for preschool rose 8% to about $7.4 billion in the last year. 6 state-funded preschool programs met all 10 of the quality standards, and 9 states had programs that met fewer than half. So you may want to actually look at your state. And then there's locally funded pre-K programs. We know that there are lots of communities around the country that are really putting in some local funds, whether it's through tax dollars or it's through grants, and but they are putting in local funds so that they can have pre-K programs for their community. And then lastly, there's the preschool development grants. The Department of Ed and the Department of Health and Human Services has preschool development grants in 18 states, serving children and families at or below 200% of poverty. And they are just beginning their 4th year of that grant. And that information is also available on the ACF or the Ed website. Early intervention. I don't know how many of you work with your Part C program, but the Part C program is federally funded and state supplemented educational and family supports for children birth to age 3 with identified developmental delays. States really set eligibility criteria, which can restrict interventions to a very narrow target population, or they can address a much broader preventive service needs. And so if you're thinking about working with early intervention, that's something to keep in mind. Generally, services are through home visits to families and early childhood providers, but many include group or center-based interventions. And in the handout that I've given you the link to be able to go look at the Early Childhood Technical Assistance Center with all the state contacts so that you can learn a little more information. And then we have the IDEA Preschool Special Ed. And this is, again, federally funded, early care and education services. It's often part day with children with disabilities, which will impact their ability to learn. School districts are formula funded through the state departments of education to provide special ed services, typically in a classroom setting. Sometimes it can be integrated into community programs as well, and children must meet strict eligibility criteria. but they have a lot of services. So again, I've given you on the sheet the Early Childhood Technical Assistance Center state contacts. I've also given you the Center for Parent Information Resources so that you have all of those state contacts for parents. And then we have home visiting. You may know it as McVee, or you may know it as something else. But from the federal government level, under the Affordable Care Act, states are funded both by formula as well as through competitive grants to coordinate and enhance home visiting. They primarily focus on the needs of pregnant women, infants, and toddlers. There are state contacts, lots of local programs. Some have home visiting advisory councils that you might want to sit on. And, you know, tools are added at the end to help plan to work with home visiting programs. We at ACF developed some early childhood self-assessment tools for shelters, but supportive housing. It's really designed to keep programs thinking about children. You know, we tend to think about housing and we think about adults, and so it's really to think about how we can always keep children in mind. So I wanted to give a very broad overview of ways to begin to think about how you could work in the community, because I know that Rachel is going to do an amazing job of telling you how some of these programs impact her in Portland and some of the work that she does in Portland. And so these are the two forms. This is the program. It talks about the program that you might want to look at, the Child Care Resources and Referral Agency, subsidized child care, jumping down, but it gives you an idea of all the possible different programs in your community that you could work with, and who is that program in your community? You know, what's the CCR&R called in your community? You know, is it called subsidized child care? Is it called subsidies? Is it through the employment and training office? You know, so that you're going to do a little bit of digging to get that information and get a contact name, but it really, I think that this cheat sheet, I tend to call it, is going to be helpful as you begin to think about early childhood planning. And then this is the form that was sent out earlier that literally gives you all the different programs and the links so that you can go there and find the information and not have to search for it. So I'm going to now turn it over to Ashley. I have to show my babies can't wait because they can't. And then I'm going to turn it over to Rachel. Actually, I'm going to see if there's any questions.
Yeah.
Sorry, Cassie. I was going to say thanks so much to Marcia. That was really fantastic. And yeah, if anyone didn't receive those attachments, just let me know, either with a message or the chat, or send me an email, and I can make sure that you have those. And then additionally, I just wanted to share also something that Cassie and I thought was really interesting, which the results of the poll showed that based on your answers to the question, do you have a formal partnership with a county, state, or federal entity around early learning initiatives, only one of you actually said yes. So hopefully, this information is really helpful, and definitely any questions that you might have, again, you can type them either in the bottom left-hand corner in the public chat section or using the Q&A chat bubbles in the top right middle. And if you are still sort of formulating your questions, that's fine too. Feel free to type them at any time, and Marcia will still be on, and we can always grab her after Rachel's presentation if necessary.
Well, and that's great to know that only one said yes, because then I think that the early care and education infrastructure in my community chart may be really helpful as people begin to plan who they want to work with, how they want to work with them.
Definitely.
Yeah, exactly. And this is Cassie. I just wanted to emphasize and thank you so much, Marcia, for providing those charts. That was something that we talked about in our prep session for this webinar, was just that this particular topic area is complex in a lot of different ways, but particularly because there's so many funding streams coming down from a federal and state level, and how they are implemented in your communities, it can look incredibly different. So I know that when I saw that chart, that really helped me, even as someone who maybe has some partnerships, to think about what partnerships I haven't tapped and who I should be looking for in my communities. And I think with that, if there are, as Abra said, if there are any questions, feel free to add them into the chat. But I think we will go ahead and turn it over to Rachel, and I think more questions will come when you are able to see someone implement this information or implement some alignments in their communities. So, Rachel?
All right. Thanks so much, Cassie. Hi, everyone. My name is Rachel Langford. I am with Home Forward. We're the housing authority in Portland, Oregon, and we serve the entire county of Multnomah. And I'll give you just a brief snapshot. And my role in the organization, I'm our Associate Director of Education Systems Alignment. So here's a snapshot. And I just have to thank Marcia. Before I dive into this, the tools that she gave you are great ones, and it is good to hear that others on the phone are in those early stages. I began the position that I'm in is a new position to the organization when it was created, and I didn't have much of a roadmap, and had I had that infrastructure document, I think my work starting out would have been a lot easier. And getting it from her, and I actually filled it out for myself and was able to reach out to some partners and fill in some holes, and it is an incredibly useful tool. So thank you, Marcia. So Home Forward, we are providing assistance to 15,000 households. That's about 9,000 children and 3,500 in that age range that we would consider early childhood. We are an MTW agency, so we do enjoy that flexibility in our funding that allows us to innovate. And one area that we want to continue to push and grow our work in education is with a focus on early childhood, and we've made that a priority in our current strategic plan. And another priority in our strategic plan that we're working on right now is redesigning how we do services at Home Forward, how we connect families to resources and opportunities. And we're really working to shift from a more kind of reactive and crisis-driven delivery of services to more upstream interventions. And so this nicely aligns with our focus on early education, because we see that as a key upstream intervention and a really strategic way to spend our limited resources. And we're also focused on system-level impact and cross-subsidy access. So not so much the small, what we often call kind of boutique grant-funded programs, but how are we adjusting our operations of our organization across subsidies to connect families to these really important resources. Where we began focusing on early learning, there was community-wide efforts going on that were focused on Ready for Kindergarten, and we were invited to some tables early on and worked with our jurisdictional partners from the county and school districts and the library system and others to help us identify where as a houser we could make a unique impact. And early childhood and chronic absence were two very clear messages that we received. And we were able to start with a focus on, there was a kind of a community-wide metric that we were all working on across school districts and jurisdictions on kindergarten registration. And we had a desire to make an impact on kindergarten registration, and it's actually what pushed us to get our first narrow data sharing agreements with all 6 school districts in our county. And that was such a strategic effort because we were able to show in a year's time through the use of these data sharing agreements, we had the data to support that we were able to, in 1 year, increase our on-time kindergarten registration 14 percentage points. And this quick and effective use of our data sharing agreements both opened the door for broad data sharing agreements with all those 6 school districts. So we widened out from that one metric to include, I mean, we can ask for a whole host of like 14, 15 different things now. And I think it really paved the way for education partners and early education partners understanding why we as a houser were a strategic education partner. And then diving into navigating early childhood systems, I have a picture of a T-Rex trying to do a cartwheel because that's a bit what it feels like in trying to coordinate and both understand the network of services, and I put systems in quotes because it's not a system. While there's not a huge variety in the types of services and programming, I mean, Marcia mentioned most of them, home visiting, daycare, preschool, Headstart. early intervention, there are many different funding streams and many different partners. And in our community, a host of nonprofit and culturally specific organizations and partners doing similar work. It's a confusing landscape. And there are a few of those, what we would consider like larger systems level partners, where we can really do data sharing, and we're exploring it now. I'll get into it in a minute with Headstart. But many of the providers are kind of the smaller nonprofit organizations that we wouldn't be able to do that larger aggregate data sharing with. So it can be hard to know where to begin. So again, kudos and a shout out to Marcia for making that a bit easier for all of you with those tools she shared. In knowing what the community was working on and where the community priorities were and what our data was telling us, that was all very important, but we knew before we really dove in with the work that we needed to hear directly from the parents. So I spent a summer, a couple summers ago, doing focus groups with parents and primary caregivers across our county to hear from them what was challenging and what supports they would find helpful as they relate to early childhood. And you see some of the key themes here, and if anyone is interested in seeing the broader findings report from our focus groups, I'd be happy to share it. It was early childhood focused as well as early grade attendance. But we know that our parents are stressed and overwhelmed. They want support. They need quality, affordable childcare. They know early learning is important, and they struggle to figure out how to do it in their day-to-day lives. I was particularly curious about home visiting programs. We have for Portland being a very white city in America, our affordable housing communities are very, very diverse, lots of immigrant families in our housing, and I wanted to understand, a program where somebody is coming into your home. I really wanted to understand if these services were being used by the folks in our housing and if they were appreciated. And overwhelmingly, in each focus group we did, there was at least one or two people who had engaged in home visiting services and by and large really liked them. We heard loud and clear that having culturally responsive providers was super important to our families. And then we got some other clear messages about ease of access. They want the services where they live, and they want help building community around parenting. I'm going to focus the next few slides on programs that Marcia highlighted in her presentation so that it's as broadly applicable as possible, and hopefully I'll be hitting on things that we all have in common, and I'll bring in some local and regional examples that could be similar or replicable in your communities. One system partner that's not highlighted in this presentation, but Marcia mentioned the library. That's a really key partner for us. It's our county public library system, and they're at the cross-sector tables where early learning is being discussed, and they're a key partner both in the community and increasingly with Home Forward. We're doing some really innovative work with them across rent assistance and property management. If anyone has questions about what that looks like, I'd be happy to answer them offline or at the end of the presentation. But we began our focus on early childhood really with a focus on home visiting. And we see home visitors as a key tool for family stability in those early years. I mean, not only do you have the important developmental work that they're doing with families and with parents and young children, but they're also forming these very important relationships with those families. And we heard that when we talked to our parents. These are very important relationships, ones that we can support and we should be supporting and leveraging as much as possible. We started because there are more than 24 organizations and all kinds of different funding streams in Multnomah County. We started with our county health department, who receives the funding through the maternal, infant, and early childhood home visiting funding stream, MCV. And they also receive funding, and this could be true in your communities. Find who is receiving funding through MCV to do local coordinating around home visiting, because that was the same agency. And so they had a very clear sort of picture of the lay of the land, and they're focused not only on the Healthy Families program, but also on systems alignment and improvement. And knowing how important cultural specificity was to our residents, I didn't want to begin our partnership exploration with too narrow a focus, like just partnering with programs that were funded with McVie dollars. I knew I had to look a little bit broader, so I worked with the health department and a local funder to get a complete picture of the home visiting services. And then I really went and met face-to-face with most of them, and I learned about the different curricula and approaches. I got a sense for the unique populations and geographies of the different partners, and from there pulled a smaller group together to further brainstorm how to create more connections between their programs and our families. And we identified early on that our home visitors, who are key to the stability of the households they're serving, really needed to better understand our system. I mean, housing is confusing, and it was a common denominator that everyone was confused and often frustrated by the housing authority for one reason or another. So we created a training and brought together home visitors from all over the county to learn about public housing, to learn about Section 8, to understand really the rules of the road, so that when they were working with their families, they were able to understand what might cause a family to get into trouble with the housing authority or to put their housing in jeopardy, and how to connect families better with our resources. So that ended up being an invaluable use of time, and something that is going to be brought back by popular demand this year, further training for home visitors. And home visitors also identified a need for community-based space for home visiting socialization groups. A big part of home visiting programs is to bring parents together with some frequency, depending on the program. It could be once a month or twice a month. And programs were struggling to have space to do that in the community that was easily accessible for families. And space and infrastructure is one thing as housing authorities that we really have. So we were able to identify community spaces across the county and give access to these partners to serve the families they were already serving, some of whom may have been ours, but some who were not, with the intention that they would then outreach and recruit our families into their program as well. And we've done this with a couple of different organizations with some success, so that reciprocal relationship is helpful. And another key challenge was for us to figure out how to reasonably help families get connected to the best home visiting resources for them, given the wide array of options. And this is where, again, that county health department that's funded through McVie around coordination and alignment has been really invaluable, because they are moving towards kind of universal screening for parents in the county in different settings, not just clinics and hospitals as it used to be, but using that screening process to refer families not just to county programs as it had been in the past, but to refer families to the broader array of home visiting services in the community. And Home Forward is helping them pilot this community-based screening outreach in our largest Hope 6 development. So moving on from home visiting to Headstart. So in Multnomah County, we have two organizations that provide Headstart in our county, and I have to say the one that we've deepened our relationship with reached out to us because they were in their community needs assessment last year. So that assessment that Marcia spoke about and said, you know, this is a really great opportunity for you to engage with your local Headstart. It's very, very true. Because we connected over their needs assessment, we saw that we had, you know, I learned a lot from this organization, and some myths were busted for me about the availability of Headstart in this part of the community. I learned that there were way more openings than I realized, that there were their wait lists weren't long enough, and they needed to build them. That families who applied to Headstart when they were doing their big recruitment push had a very high likelihood of actually getting into the service. And that was incredibly powerful for me to learn. So we initially focused our engagement on recruitment. We did some broad, just blanket, every Section 8 and public housing resident in their service area got a co-branded letter from us encouraging families to sign up, and this year they had expanded full day slots overlaid with areas where we have high concentrations of 0 to 5-year-olds. So we did this broad-based mailing, but then we followed up where we had apartment communities that were in sort of this where there was the nexus of, a high availability of slots, some extended day options, and lots of 0 to 5-year-olds. And we did, we pulled their staff to come to events over the summer and in the spring going into summer to directly recruit families and then did our own sort of door knocking and information sharing about it as well. This foundation has laid the groundwork for us to move the partnership, I think, up to a larger systems level and to really begin to talk about data sharing, and that's what we're exploring right now. How do we understand the overlap between the folks that we're each serving so that we can better target around recruitment and then ideally, leverage our engagement with families different than we already are. I have a big focus on operationalizing the partnership so that it doesn't just live with me and a director, but that we're building relationships between our direct line staff and doing that cross-training that we know is so important so that staff on our side who are working with residents really understand the services and have names and faces and phone numbers to the people who provide those services, and likewise that they understand the housing authority and our services. And know how to access our system and have warm relationships so that when we're working with families, there are warm handoffs happening. And then I see as a potential something that could be so helpful is leveraging their parent engagement strategies and tools. They are probably the nation's first 2-generation program. They do incredible work with parents. As we seek to do more community building and skill building with parents, we really want to leverage them as a partner in that, and they're excited about that. So the last program that I'll talk about is childcare resource and referral, so another funding stream that Marcia talked about, and that is what it's called in our community. We know that quality, affordable childcare is a huge need in our community. We're trying to think about how to meet that need creatively with the resources that we've got. And so one thing we've been exploring is how do we identify and support our parents who are providing that informal care environment to family, friends, and neighbors. How do we provide training and support to those parents, potentially bring them together? There are some neat things happening in the community about connecting parents who are providing that type of care to do kind of their own professional development, for lack of a better word, so that they're providing really high quality care and getting the support that they need. So we're exploring that, as well as what I know some other housing authorities have done. I don't know if any who are on the call today have done it, but supporting child care businesses in our communities, helping our residents provide high quality care, and we want to lean on our CCR&R to help us with the training and the licensure of those residents if we choose to go down this route, and that's something we're still exploring. Oh, and this thing on the top, the Community Child Care Initiative, this is just one example. I put it on there. It's unique to Portland, but we have a local tax levy for children's programs, and they fund a lot of these programs that I've been talking about are funded through the children's levy. And one of their initiatives is a partnership with our child care resource and referral to help basically directly subsidize families to help them pay for their child care. And what is so great about this program is that it serves families up to 200% of federal poverty level, and it helps ensure that no more than 10% of their annual income is going to child care. So that's a huge benefit. It's something that we promote that our child care resource and referral is running with taxpayer dollars. And we look forward to just growing and expanding our relationship with child care resource and referral. And with that, I'm cognizant of time and realize there could be a couple of questions. So the last thing is just my contact information. I am always willing and excited to talk about the early childhood work in the housing authority realm because I feel like it's kind of a newer, there aren't as many of us who are really focused on it. For me, it's my primary focus, and it is a challenging sort of landscape with a lot of nuances, and I think there's a lot we can learn from each other. So do not hesitate to reach out if there was anything in this that was interesting to you that you would like to hear more about. I'll stop there.
Great. Thank you so much. I'm always just so impressed by the extent of what you're doing and how the work continues to evolve. So just a reminder, if folks have questions that you want to pose now as opposed to being in touch later, please type them in the public chat or the Q&A bubble section. And if you're having any technical difficulties, just let me know.
And Rachel, it doesn't look like we have any questions just yet,
okay.
So I'll start with one, which is that was really interesting to hear about the initial opportunity focused on kindergarten enrollment. Who was that through? Like if I'm a partner or if I'm a housing authority that doesn't have any partnerships in this area, and I was just looking to start on that, was that your individual school district or was that like a citywide initiative?
It was like a county-wide, it was a collective impact, Ready for Kindergarten collective impact effort that was driven by multiple entities in the city. We have a kind of a backbone, collective impact backbone organization called All Hands Raised. They were key conveners of that group, as well as another organization called Social Venture Partners. So there was really, and they were, the table they set was huge. When these meetings initially, the Ready for Kindergarten meetings had more than 100 people in the room. And so that was kind of our initial engagement. And I think our ability to run with something right away was very instrumental in how our partnerships were able to develop quickly after that.
Yeah. And and I'm just curious also, in terms of the data, were you like surprised, or what was when you were able to learn more about your population through that data, as far as like the rates that they were enrolling at? Was that something that was new to you, or did you already have access to that level of?
We hadn't looked at that data, and that this really, it spurred this was our first data sharing agreement, so we hadn't done this data match with the school districts before, and we were definitely, I think our rates were not shockingly low. They seemed comparable. When you looked, our only other sort of proxy measure was free and reduced lunch. They were comparable. But what we were able to do with our, the mailing that we did, and then we mailed to everyone, and we did it in such a way, we have our data system overlaid, and this all happened around the same time too. We overlaid all the school district information into our own data system, so we were able to pull up really specific information. So when we were sending parents reminders to register, the letter, it was a merged letter that said, this is your neighborhood school, here's how you follow up, here's the brochure, the flyer, really specific. And then wherever we had relationships, so in our housing communities, we had our resident services staff. Every year we send them letters, we send them a spreadsheet. Here are all the incoming kindergartners at your property this year. As you see folks, or if you don't see folks, knock on doors and encourage them to register for kindergarten. And then that was backed up with, posters and other triggers in the apartment communities and around the community. So it was just, we weren't paying attention to it before. We did very minimal intervention. Honestly, it wasn't a complex intervention at all. And to see, with that bit of effort, what we were able to achieve, I think it was the jump in one year that really, and then the following year we sustained it. So I think that was surprising and encouraging.
Great. Thanks for sharing more information.
Sure.
On how that all went. It sounds like a really great opportunity. And then we do have a question from Kathleen. Rachel, do your efforts require much additional funding from Home Forward, or is this funded by federal funds leveraged by your partners. So if you can speak a little bit about the funding model, that'd be great.
Sure. So as I stated initially, and I think Kathleen knows about me and the work that we've done in the Pacific Northwest, much of what we're doing is with our existing agency resources. So being an MTW in that regard helps. Really, it's my time, like when we're talking about all the things that we've talked about that require looking at our data or relationships, it's my time, it's the time of our internal staff. And then we are bringing no additional funding to the table. So I see this as true systems, collaboration and alignment, in that we're each doing what we do in coordination. The partners that I've talked about are not working with us only if they have additional funding. They're seeing us as a key way to meet the goals of their program or the mission of their program. So all of it has happened within our existing funding streams, which has been great. And what I feel like I feel like that's what's sustainable too in this environment of constricting resources and our local foundation community becoming more and more taxed to meet needs. I'm sorry, I cut somebody off.
I was just going to say that one of the things that we've been hearing at the federal government level is how do we do the work more efficiently and effectively, and I think that Rachel shows that there's a way to do that, and I think that we should tell the story of, the good things that are happening rather than, any chance and every opportunity that we have.
Absolutely. And how we're using our existing resources differently to get better outcomes for our families.
That doesn't mean that we don't need more. It just means that we are creative about how we use the resources, and that we could do even more with more resources. Absolutely.
Yes, indeed, and it looks like we are kind of coming up on our hour together here, so I'm not seeing any additional comments or questions at this time, so thank you. But thank you, Marcia and Rachel, for presenting today and giving us all this great information. I think there's definitely going to be some great follow-up and resources available. Abra, any final reminders before we head out?
No, I just want to echo Kathy's thanks and also say thank you to all of you who took time to join us today. I'll send a note out to the whole group when the recording is up on housingiS.org in the CLPHA Education Working Group community folder. So you can re-watch it if you'd like, re-look at the slides, or share with colleagues who maybe weren't able to join today.
Great.
Happy holidays.
Thank you all so much.
Thanks, everyone.
Thank you.
Bye-bye.
Bye.